Hey there, and a warm welcome to our brand new YouTube channel. We know that there are already plenty of channels out there about dentistry, but we're excited to bring something a little different to the table. Our focus is on helping students remember those essential topics that are crucial in our profession as dentists, the little details that we might think we know but actually don't. Our goal is to make dental topics easy to understand and approachable for everyone. We truly believe that learning about dentistry can be fun and engaging, and we want to share that excitement with you. So whether you're a dental student looking to brush up on your knowledge or just someone curious about the field, we've got you covered. So join us on this journey of discovery. We promise to make it informative, friendly, and most importantly, enjoyable. Let's dive in and explore the world of dentistry together. Today, we'll be discussing some common anatomic variations and some genetic disorders of the soft tissues that are interesting and important for dental students to know. Let's start with some common variations that we can find in the mouth. All right, so let's dive right in and chat about our first topic, Linnaea alba. This is a white or grayish-white line that can sometimes be seen on the inside of the cheeks. It's nothing to worry about, as it's usually caused by the rubbing of the teeth or the tongue against the cheeks. It's not harmful and does not require any treatment. Next, we have leukoedema. It is a condition where the inside of the cheeks appears milky or cloudy. It is a harmless condition that is quite common in the general population. It is usually seen as a white or grayish-blue diffuse opalescence on the buccal mucosa. Leukodema is caused by the accumulation of fluid between the surface layer of the mucosa and the deeper layer of the tissue, which causes the mucosa to appear swollen and cloudy. The condition is usually seen in people with darker skin pigmentation, and it tends to become less noticeable as the person ages. One typical characteristic that can help us to differentiate it from other conditions is that leukodema disappears when the cheek is stretched. Coming up next, we have normal pigmentation. The color you see on the inside of the cheeks can, in fact, vary significantly from one person to another. You might notice that some individuals have a lighter shade of pink, while others might have a darker shade. This is a normal variation and is not a cause for concern. All right, now let's continue with Fordyce granules. Small raised yellow or white bumps can appear on the lips, inside the cheeks, or in other areas of the mouth. This is a normal variation of the sebaceous glands, so no treatment is needed. So next we have oral tori. These are bony growths that develop in the mouth. These growths are usually located on the roof of the mouth named torus palatinus or on the lower jaw named torus mandibularis, and they can range in size and shape. While oral tori are usually harmless and do not require treatment, in some cases they can cause discomfort or interfere with oral function, such as chewing or speaking. In these cases, surgical removal may be recommended. It's important to note that oral tori are not caused by poor oral hygiene or lifestyle factors. They are usually discovered during routine dental exams and do not require any specific maintenance or care. Next, we have masseter hypertrophy, which is a condition where the masseter muscle responsible for chewing becomes enlarged. This can cause a bulging appearance in the lower jaw area and can sometimes cause pain or discomfort. While masseter hypertrophy can be caused by a variety of factors, including genetics, teeth, grinding, or jaw clenching, in many cases, the exact cause is unknown. Treatment for masseter hypertrophy can vary depending on the severity of the condition and any associated symptoms. In some cases, lifestyle changes such as reducing stress or avoiding hard or chewy foods can help alleviate symptoms. In more severe cases, medical interventions such as Botox injections or surgical procedures may be recommended to reduce the size of the masseter muscle and improve oral function and appearance. To conclude this section, let's talk about hairy tongue, a harmless and common condition where the tongue appears to be covered in a layer of hair or fur. The cause of this condition is the excessive growth of papillae, the tiny bumps on the tongue's surface that contain taste buds. If these papillae grow too long, they can trap food particles and bacteria, causing the tongue to look hairy. Despite its unusual appearance, hairy tongue is generally not a cause for concern and can be resolved by addressing the factors that contribute to the condition, as well as practicing good oral hygiene, such as regular tongue brushing or using a tongue scraper. Now let's talk about a few oral congenital disorders that dental students should have some knowledge about. The first condition on this part is called lip pits. These are also known as lip sinuses or fistulas. These are small depressions or openings in the upper or lower lip, more commonly in the lower lip. These pits are a type of congenital anomaly, meaning they are present from birth. While lip pits are usually harmless, they can sometimes be associated with other conditions such as van der Wood syndrome. In some cases, they can become infected or inflamed, which can cause discomfort or pain. Next, we have ankyloglossia. It is a condition where the frenulum, the band of tissue that connects the tongue to the floor of the mouth, is too short or tight. This can limit the movement of the tongue, making it difficult to speak, eat, or perform other oral functions. While some babies with ankyloglossia may not experience any problems, others may have difficulty breastfeeding or may experience speech problems as they get older. If ankyloglossia is causing problems, it can often be treated with a simple procedure called a frenectomy, where the frenulum is clipped or removed. This is usually a quick and relatively painless procedure that can be done in a doctor's office. All right, let's continue with cleft lip and palate. This condition happens when the tissues that form the roof of the mouth and or upper lip don't completely fuse during fetal development, resulting in a gap or opening. This can lead to a range of health issues, including difficulty feeding, ear infections, dental problems, speech and language delays, and hearing loss. However, with proper treatment, children born with cleft lips and palate can live healthy, happy lives. Treatment often involves a team of specialists, including surgeons, dentists, speech therapists, and psychologists, who work together to address the child's specific needs. Surgery to repair the cleft is often necessary, as well as ongoing dental and orthodontic care, speech therapy, and psychological support. The timing of surgery depends on a few factors, such as the severity of the cleft, the age and health of the child, and the individual needs of the child and their family. In general, surgery for cleft lip is usually done when the child is around 3 to 6 months old, and surgery for cleft palate is typically performed when the child is around 9 to 12 months old. Next, we have bifid tongue, also known as tongue tie or tongue bifurcation, is a rare condition where the tongue is split into two distinct sections. This can occur due to a variety of factors, including genetics, environmental factors, or underlying medical conditions. While bifid tongue is usually harmless and does not cause any symptoms in some cases, it can cause difficulty with speech, eating, or other oral functions. In some cases, a bifid tongue can be treated with surgery to repair the split and restore normal function. However, in many cases, treatment is not necessary, and the condition can be managed with regular oral hygiene and monitoring. Next, let's talk about congenital double lip. This condition affects the appearance of the lips and is caused by a developmental defect in the connective tissue of the lip during fetal development. Congenital double lip is characterized by an excessive fold of tissue on the upper or lower lip, giving the lip a thicker and fuller appearance than normal. Although it is a benign condition that usually does not cause any functional problems, it may affect a person's self-esteem and confidence. The surgical procedure involves the removal of the excess tissue and reshaping of the lip to create a more natural contour. Lastly, macroglossia, which is characterized by an abnormally large tongue that can cause functional problems and affect a person's quality of life. Macroglossia can be congenital or acquired. Congenital macroglossia is usually present at birth and can be associated with genetic syndromes such as Down syndrome or Beckwith-Wiedemann syndrome. On the other hand, acquired macroglossia can be caused by a variety of factors such as inflammation, trauma, or tumors. In some cases, macroglossia can cause problems with speech, eating, and breathing. It can also affect a person's appearance, causing the tongue to protrude out of the mouth or create a gap between the upper and lower teeth when the mouth is closed. So, treatment for macroglossia depends on the severity of the condition and its underlying cause. In cases where the condition is mild, speech therapy and lifestyle modifications such as weight loss and avoiding irritants can help to alleviate symptoms. In more severe cases, surgical intervention may be necessary. So, there you have it. Some common variations and congenital disorders of the soft tissue that dental students should be aware of. Keep in mind that recognizing these conditions in patients and providing appropriate treatment or referral is essential for a successful dental practice. Join us for our next one, where we'll be diving deep into the world of dental disorders. Thanks for tuning in, and we'll see you next time on our dental education channel.